By the end of this presentation, you will be provided with a direct solution to controlling the rising costs of your healthcare premiums, at the same time providing immediate savings and keeping employees pleased with the benefits package they are offered. We call this solution alternative funding. The most valued employee benefit is also employers' number one long-term concern due to the cost and traditional options being presented today. Medical insurance premiums have trended towards double-digit premium increases for years, which is unsustainable for most employers at their current benefit level. To control cost, some employers have simply changed the benefits offered to lessen the cost of the premium. Even though changing the benefits to reduce premium solves one problem, it creates another, that being the risk of losing key employees. Alternative funding can be your answer to reducing premium costs while keeping benefit levels at or above what they've been in the past. With alternative funding, it's a benefit strategy that takes advantage of the premium savings created by the employer, choosing a high deductible medical plan, and at the same time offering an additional plan to reimburse employees. And if the employer chooses to, they can also reimburse the employee's covered dependents, but for the difference in the copay, deductible, and/or coinsurance expenses from the prior year's plan. Many times, and in the context of this presentation, the plan that reimburses the employees is a Health Reimbursement Arrangement, or HRA. The reason HRA is used is because of the tax advantage it creates for the employer to reimburse the employees for expenses as they occur with the premium savings created by the new medical plan. All the premium savings not reimbursed are monies left over to the employer. As we mentioned before, solving the premium problem is only one key item that alternative funding addresses. The second is maintaining a plan design that will keep employees feeling appreciated and understanding that their employer has the highest intention to take care of them, including the key employees. Since alternative funding is typically used to keep benefits similar to what was offered in the past, employees appreciate that consistency. In addition, since the plan is tax advantage to the employer, reimbursements are tax advantage to the employee, meaning the monies received are not considered income to that employee. Lastly, with the employer saving money on the premium from choosing the high deductible medical plan, if the employee is required to contribute to paying for the premium, the reduction in premium cost is typically passed along to them as well. This is also an important time to mention that HRA contributions can only be made by the employer, meaning employees cannot fund the HRA. To illustrate how alternative funding works, let's review a quick sample company and steps that were considered and ultimately the results. The company data being used is actual data from the first company we did business with using this concept. The first thing to look at with alternative funding is the alternate medical plan. In this case, all major benefit items are the same, meaning the copay, RX, and coinsurance. The only difference was $1,500 in deductible expense from the current to the alternative plan, which the HRA was set up to reimburse each employee and their insured dependents, only after they met the initial $500 of deductible expenses. Changing the medical plan from a $500 deductible to a $2,000 deductible created the premium savings illustrated here. Even today, we see similar premiums, albeit the employer's current plan typically has a $1,000 or a $1,500 deductible, and they are considering a $2,000, $3,000, and sometimes a $5,000 deductible for the alternative medical plan. To complete the basic premium savings analysis, we multiply the number of employees per premium tier by the amount the employer is saving per month and then per year. Remember, only employers can fund the HRA account, so only the employer premium savings should be considered on a savings analysis. Ultimately, with this employer, the annual savings was about $23,000. The premium savings is the first step of an analysis when alternative funding is being considered. The next item to consider is the risk of how much of the premium savings will be used to reimburse employee claims. Historically, we've been able to measure what the average company's reimbursement percentage of the total premium savings has been over the last 4 years. In the case of this group, the $23,000 of premium savings was significant enough to use the alternative funding concept. At year's end, they had paid about $2,200 in reimbursement claim costs to the employees, and in addition, they made the decision that having a third party reimburse the claims was in their best interest and paid an additional $1,200 administration fees to Polestar Benefits. Ultimately, the premium savings was $19,419.02, a relatively considerable savings for most companies.